2, 3.
Hi, we're going to talk today about use of the low power laser, smart laser, in treating myofascial pain in a number of specific areas. The first one we're going to talk about is temporomandibular dysfunction, which is the medical term used to differentiate from TMJ, which should never be used in a diagnosis on a patient unless there is actual joint damage that is going to be corrected surgically. Otherwise, the insurance companies will disallow all the treatment that they are getting. Basically, TMD is a medical problem that the dentists are helping with the appropriate splinting. It's temporomandibular dysfunction and involves trigger points, myofascial trigger points in the muscles of mastication, and also some of the neck muscles, both in the anterior, lateral, and posterior neck, all of which can contribute to head posture and to abnormalities of the bite that patients, or the occlusion that patients will develop with these problems. They can start from trauma, they can start from chewing too many very difficult, hard to chew items. They can start after a dental procedure where the mouth has been kept open for a very long period of time. And invariably the symptoms will include pain at the site of the trigger points, the dysfunction in terms of the muscles being very tight and the interincisor opening being quite limited. Occasionally it will also contribute to the cartilage that is in the temporomandibular joint being extruded and not be able to return, meaning that the jaw will be stuck, most likely in either an open or a closed position.
Well, Dr. Filner, how does the ML830 laser help in those types of conditions?
The use of the laser to inactivate trigger points in these muscles to allow for the muscles to be stretched is invaluable, primarily because it's painless and risk-free and works. In addition, it works in addition to being able to inactivate the trigger point, but also to relax the muscle. And you can simply palpate the trigger point, and if it's not quite apparent initially, just have the patient open their jaws slightly and it will bring out the trigger point. And you can use both to treat both the superior and inferior parts of the masseter muscle here, the temporalis muscle, which can also create problems as far as opening or closing the jaw and pain. Particularly, these muscles can also cause trouble with tooth pain. When x-rays show there's nothing wrong with the tooth and the examination shows nothing wrong with the tooth, yet the patient's complaining of pain, think of these trigger points referring pain into either the upper or the lower teeth. That's a very common problem. In addition, any of these muscles can give you tinnitus, can come from one of the masseter muscles or the sternocleidomastoid muscle. And all of the muscles in the neck can contribute to this by the positioning of the neck and making the jaw pain more accessible, or much more intensity. Given the fact that a lot of these neck muscles will refer pain into the areas where these trigger points in the muscles of mastication are located. So one has to look extensively not only at these muscles of mastication, but also in the muscles in the neck, particularly the anterior part of the trapezius muscle, which refers to the temple and the angle of the jaw. You also need to look in the sternocleidomastoid muscle, the scalene muscles, and the posterior muscles that can alter the position of the head and therefore the position of the jaw when trying to open or close it.
Okay. Dr. Filner, how could people get a hold of you, patients or clinicians that want to refer some patients to you? How do they get hold of you, doctor?
The easiest way is on the internet by email. My email is Dr. Filner, that's DrFilner, all one word, lowercase, at thepaincenter.com. all one word, lowercase, .us. So it's Dr. Filner at thepaincenter.us. I usually will be able to answer those emails within a few days.
And your office number, Dr. Filner?
It's area code 301-251-1266, and we're located in Rockville, Maryland, which is about 20 miles outside of DC.
Okay. Well, Dr. Filner, in closing, any final comments for dentists that'll be watching this videotape in weeks and months to come?
There are a number of other sort of more esoteric issues that need to be looked at, and we can mention those at a later time that can complicate the TMD type symptoms and make the diagnosis very enigmatic in terms of difficult to come to. And certainly once the evaluation has been completed, then the dental expertise has to come in terms of using lower level splints to allow the jaw to move forward and ease the necessity of clenching.
Great. Well, Dr. Filner, thank you for your time, and look forward to visiting with you again in the near future. Thank you, Doctor.
You're welcome.